I wasn't given any warning, no brochure, no pamphlet that this is going to be the rest of my life.
Canadians with endometriosis have long been pleading for better health care. As common as this condition is, there are still many unknowns, and for some patients, the journey to diagnosis and care remains long and painful. Amid the barriers is sexism in healthcare.
I received my endometriosis diagnosis in 2017. Unfortunately, it took 7 to 10 years and probably seeing multiple doctors, about 10 doctors, before I received the official diagnosis.
Stacey Savory's journey isn't uncommon. She was diagnosed at the age of 25 with the most severe form of endometriosis.
I do think it could have been caught earlier if the doctors believed me. They just thought, oh, you just have a very bad period, but it wasn't. It was something more.
In endometriosis, tissues like the lining of the uterus can grow elsewhere in the body. Symptoms include pelvic pain and infertility. Some patients, like Samantha Roberts, can trace symptoms to when they started menstruating. And chronic pain can strike any time, including during periods, sexual intercourse, and urination.
It really does feel like someone is going and stabbing my insides and twisting that knife around.
In her early 20s, Samantha pushed doctors for answers. She says she was lucky to get a diagnosis shortly after, but seeing an expert took much longer.
It probably took about 7 or 8 months just to get a phone call, not from the doctor. And then I finally met him after about a year. And then again, I'm put back on the end of a wait list that could take another 2 to 4 years to even get that extended care that I need.
And the pandemic worsened wait times significantly, delaying diagnosis, care, and especially surgeries. We traveled right here to Ottawa to speak with one of Canada's leading experts for endometriosis care.
In my own practice, when we did an audit, it took up to 7 years for patients who first started to have symptoms to finally get a diagnosis. Because again, we minimize the impact of pain or understanding the issues around women's health.
Is there a danger in waiting for a diagnosis?
When we talk about treating endometriosis early, we're talking about preventing a lifelong chronic pain issue that is very difficult to treat later.
There is no cure, but doctors say diagnosis and treatment is important. Some may also need surgery, but that can also take years.
There's an absolute danger in waiting for surgery for those who really need it. They can't work, they can't go to school, they can't do what would make them a wholesome individual in this society. You lose years of your life waiting for care for a diagnosis and surgery. It's insane, and it's not right.
Dr. Singh receives daily requests from around the country, while there are also some patients who opt to travel abroad to get help, paying thousands of dollars out of pocket.
Because of the desperation of our patients, there are many units that are being set up privately outside of Canada who are on a for-profit model, and our patients will go.
It's been called a silent crisis, impacting millions of people all around the world, including here in Canada. Patients with endometriosis say the journey to getting diagnosis and basic care is long and painful, feeling invisible as they struggle to navigate Canada's healthcare system.
People called me bipolar, people called me that girl's crazy, or she has issues.
She says her pain was often dismissed, including by doctors.
There were times where I would pass out and I would end up in the hospital.
Now in her 40s, Stacey's awaiting to get a third surgery.
My first surgery, excision surgery, they removed 16 fibroids and 2 cysts, so that's 18 pieces. The third one is for the removal of my ovary and possibly hysterectomy.
Waiting for diagnosis and to see an expert takes years for many patients. One of the leading experts of endometriosis in Canada and a patient advocate, Dr. Soni Singh, says Canada has more endometriosis experts today than ever before, but still too few, and there aren't enough resources.
To make the diagnosis with high quality imaging and being able to see an expert. So we just don't have the imaging capacity.
And surgery wait times are brutal. It can take 2 to 3 years in Ontario for a much needed procedure, which can have severe health consequences on a patient.
I lose sleep over the fact that I know that individuals who need gynecologic surgery in many different areas can't get that care. And that is distressing, and it puts an additional moral burden on the physicians to be able to provide the care they want.
And he adds the condition is a tip of the iceberg when it comes to women's health and those with uterus and ovaries not being prioritized.
Those who are most affected are often from marginalized populations. In addition to having the endometriosis, they have barriers to accessing care.
Which is why Endo Warriors have created a network across Canada on the front lines advocating for themselves and others, calling for better education, awareness, and research.
I will no longer stay in silence, and I want to be able to help someone else get an earlier diagnosis, a young woman like myself in the 24th. So now in my 40s, so when I'm trying to have a baby.
Now, Health Canada says there currently is no national surveillance data on endometriosis. It's something that experts, advocates, including Dr. Singh, have called for to better understand the scope of the problem. Tomorrow on CityNews, the struggles, the heartaches, and the painful journey many are left to deal with on their own.
Really hard to process that you may not be able to carry your own child.